At the outset, I would like to ask you, what is the average life expectancy of Indians? Any idea? Yeah, around 70 years. It is still 10 years less than the advanced nations like Japan, Korea, some countries in Europe and Americas. Any idea what was the life expectancy of our grandfather, their grandfather, their grandfather? 110? 100? 90? Okay, so when the British left India, the life expectancy was, I think, 37, right? And if you trace every year or every decade back, it was even lesser. So what improved? Sanitation, hygiene, vaccinations, medical advances, NCDs detection and treatment, amongst various factors. So with the increasing age, there are other issues like NCDs. So aging, it's a complicated definition, but just to cut it short, it is telomere shortening, there is inflammation, and there is mitochondrial dysfunction. So the big physiological function one has between 20 to 30 years of age. There is good muscle mass, the VO2 max is good, bone density is at its peak. But the first measurable cellular aging signs are seen within the year of 30 to 35. There is DNA methylation changes, there is telomere shortening. After, in the 40s, there is sarcopenia, reduced basal metabolic rate, neurovascular changes. And after the age of 60, you can see immune system weakening, cognitive slowing, and frailty. You may be able to brisk walk, you may be able to jog, but you cannot sprint after the age of 30 or 35 unless you actually train for it. So everything is driven by the fat, the deposition of fat at abnormal places in most of the organs, especially intracellularly. You are what you eat. So your stomach size is this much, around the size of 2 fists. तो इसमें हमको क्या भरना है? इतना ब्रेकफास्ट, इतना सारा लंच, इतना सारा डिनर. So you are supposed to fill your stomach with healthier options like this and more protein, but ये तो ब्लैंड होता है, इसको टेस्टी बनाने के लिए क्या करना है? बहुत मसाले डालने हैं. So make it so spicy that you cannot eat it directly. So you have to dilute it with, right, chapati. Chapati तो dry रहता है, तो उस पे क्या लगाना है? Ghee. Very good. So ultimately, the health conscious people, they use oil very sparingly, ideally in drops, but most of the Indians fail to do it. Salt intake should ideally be 3 to 5 grams, but many have it 10 to 15 grams per day. So all these factors ultimately lead to fatty liver, that is an indirect indicator of obesity. Gut-brain axis is a very complicated thing. It is interplay of many hormones like ghrelin, leptin, you all know it. There is also interplay of many neurotransmitters in the brain, but to make it simple, there is hypothalamus. It is a switchboard, like when fuel is low, it makes you hungry. When full, it should signal stop. So hunger and satiety center are in the hypothalamus. But that was the old hypothesis. Now newer areas of the brains are discovered, like amygdala, that sometimes we don't eat because we are hungry, but because we are sad, stressed, or bored. That emotional part of the brain pushes us to eat for comfort. Then there is nucleus accumbens. It's that part of the brain that lights up when you see pizza, sweets, or fried snacks. It makes food exciting and rewarding. So in a person who struggles to lose weight, nucleus accumbens and amygdala are dominant. But there is also an area called prefrontal cortex. This is the thinking part of the brain. The one that says, I know you want that cake, but I don't actually need it. It's your inner referee. So if you want to lose weight, you need to strengthen your prefrontal cortex. You can do it by increasing protein intake in your food. strength training, and by practicing small habits like pausing, eating mindfully, and planning your meals, you strengthen your prefrontal cortex. And over the time, your cravings will still come, but you will be in the charge and not them. So obesity is normal response of the body to abnormal environment. Have you ever used ChatGPT? सिर्फ एक फोटो लेना है, अपलोड करना है, it shows the calorie, it shows different content and its calories. Make it a habit. It helps in big way. Sleep. 1/3 of our lifetime we are supposed to sleep. Again, 1/3 of our lifetime we are supposed to sleep. Wakefulness is lower level brain damage. It accumulates beta amyloid and tau protein. These are two culprits that underlie the Alzheimer's disease cascade. And sleep is your sanitary salvation. So we are supposed to reach this stage 3 and stage 4 every night multiple times. This is where healing occurs. This is where aging slows down. But it takes around 90 minutes to reach that stage. लेकिन क्या होता है, when you reach stage 1, stage 2, stage 3, पार्टनर खर्राटे ले रहा है, पार्टनर लात मार रहा है आपको, मच्छर काट रहा है, कुत्ते भौंक रहे हैं, बच्चा रो रहा है, and so on. So you are not really able to reach stage 3 and stage 4 consistently. Other day, next day you are irritable. This continues for weeks, months and years. So ideally one should practice sleep hygiene. कितने लोग without alarm उठते हैं? बहुत कम. So ideally you should plan your sleep so that you should wake without alarm. And these are different points which helps in sleep hygiene. Any idea what sleep divorce is? Husband wife they stay together whole day, but सोते समय they prefer to sleep in a different bedroom, preferably in a same house and preferably alone. You can use filters like Twilight on your app which helps you sleep faster. Spine health. A person's decline starts with lower back and thigh. The muscle gets weaker, the posture declines, and with age there is cognitive decline, emotional issues, depression, there is severe muscle weakness and bone loss. And one unfortunate day, bathroom में पैर फिसलता है, and then what happens? Hip fracture. So the statistics of hip fracture after the age of 65 are very frightening. 1 in 3 people cannot survive beyond first year. It is worse than even some top cancers. So does the person die of the fracture? No. He dies of weak muscles, weak bone. He cannot move. And then infections catch in, or there is severe issues which causes the mortality. Most of the international flight, सबसे आगे कौन रहते हैं? इंडियन लोग. Weak muscles, weak bones. I'm not making this up. These are the headlines. So muscle, we lose 1 to 3% lean muscle mass per year after the age of 30. Muscle is your organ of longevity. It is your greatest defense against aging. The grip strength is strong predictor of severe mortality, and yet we treat resistance training as optional. It is not. Walking, the CV benefits start after the 4,000 steps per day, and with each 1,000 steps increment there is decrease in severe mortality. But is walking enough? Does it challenge your muscles enough? Does it help in balance, upper body strength, bone density, joint stability? No, it is strength training. So types of exercises, just 2 minutes. This type of exercises, aerobic and strength training. Those who are not familiar with the exercises, you can do them at home. You can take the resistance band. You can stretch them in various positions. You can use ankle weights. You can do heel raises during flossing your teeth, cooking. You can do wall push-ups. You can do chair squats without taking support of your arms. You can do farmer's walk. First you start with 5 kg, walk for 1 minute, then 10 kg, then 15 kg. It strengthens your core. And if one can afford, or if it is practically feasible, you can join the gym to challenge your various muscles. By the way, this is my mother who started her fitness journey at the age of 72. Now she's 75. But after 2 weeks, it is very difficult to find your consistency. So you must find your own why. So, for example, my why is playing badminton. I do fitness for playing badminton. Someone does it for dance. Someone does it for looking good. So you must find your why. You should avoid prolonged sitting. You should take steps instead of escalator. You should walk during talking on phone. The common excuse is you don't have time, but you can have 100 problems in life until you have a health problem, and then you only have one. If it doesn't motivate you enough, exercise also improves sexual health, cognitive health, and cardiovascular health. You should address your mental health. It is important to seek help from professionals as and when required. These are blue zones where people, last 2 slides. These are blue zones where people live more than 100 years. These are their common characteristics. They eat unprocessed diet, good sleep, they move around throughout the day, they stay social, they have family values. इसमें कुछ different नहीं है, हम जो करते हैं वो ये, but हमको इसके लिए efforts लेना पड़ता है. This is imbibed in their culture. As a diabetologist, this is probably my greatest achievement. I have been able to inspire my twin daughters to play badminton. My wife, she is into fitness, and these are my mother-in-law and mother at the age of 65 and 75. I guess they are fit enough. So the key takeaways are, your genes are your predisposition, but they are not your fate. Your lifestyle decides whether a particular disease would express itself or not. Every gram of protein you don't eat is the additional gram of carbohydrate and fat you consume. You should learn the art of cooking in less oil and less salt and develop taste for it. A night's good, uninterrupted sleep is the best thing you can give to your own body. Movement is medicine. Prolonged sitting is a disease. Exercise has benefits, but if you have to exercise to keep your weight down, your diet probably is wrong. Exercise must be the part of your personal hygiene. Health is muscle, but you must find your why. Quality of life after 35 depends on your today's choices. So your body does not give a damn about your diet or gym routine if you're constantly overwhelmed by your life circumstances. So you must prioritize your mental health and mental peace. And there are 2 pains in life. One is the pain of discipline, and other is the pain of regret. You must choose either. And you often say you'd die for your family, but would you get healthy for them? Thank you.